Okay, so we are here with Dr. Elissa Cohen. She is with Viverant. She is a pelvic floor PT, doctor of physical therapy, works with women and specializes again in this field. She's amazing. We work with her in our clinic, frequently sending patients, but aside from that, she's just also a wonderful human being. So she's here to answer some questions about what the pelvic floor is, and that will lead us into that first question. What is the pelvic floor?
All right, so pelvic floor is the muscles at the base of your pelvis. So underneath the bladder and uterus here, you have that bowl of pelvic floor muscles. And so you have external pelvic floor muscles that are like sphincters and hold urine and stool and things like that. And then you have those deep pelvic floor muscles that they attach to the pelvis and sacrum, so they help stabilize the sacrum and the spine. They perform sexual function, they help hold us upright to gravity and help with posture, so they do lots of things.
And then what happens to the pelvic floor during pregnancy?
So during pregnancy, a lot of people think that okay, those muscles are just gonna get really stretched out because you've delivered a baby, so they're gonna be weak and stretched out, which is part of what can happen for sure. But also those muscles are responsible for holding a baby for 10 months, and then during delivery, they stretch very quickly and sometimes can tear or is trauma to those tissues. And so sometimes postpartum you can also get tight muscles because they were traumatized and damaged during delivery. So yeah, that's what they do during pregnancy and delivery.
And that leads us into conditions that women deal with, issues that they deal with postpartum, or even sometimes during pregnancy. But what are those things that you see women dealing with?
Yeah, so a lot of times during pregnancy too and postpartum, we see incontinence, which means just leaking urine with stress, coughing, laughing, things like that. It can also mean going to the bathroom more frequently because you can't hold it or because you're getting strong urges that you can't resist. Pain with intercourse, prolapse or pelvic floor heaviness, low back pain, SI joint pain, pubic pain. Those would be the main ones.
And then what do you, as a pelvic floor PT, what do you actually deal with? Like when patients come in, do you treat all of those conditions? Just kind of explain what you do.
Yeah, so with pelvic floor physical therapy, yes, we're treating all those conditions. We're doing a lot of soft tissue work and manual therapy because we want to make sure that those muscles are not too tight, that they're nice and long, and they can go through their full range of motion first. And so we're doing manual therapy to address that and giving you some stuff at home to work on to address any range of motion limitations. And then we're going to work on strengthening. And so if there's weakness and weakness in those muscles, whether it's pelvic floor muscles or the supporting muscles, so like low abdominals, glute med, glute max, even inner thigh muscles, if there's weakness there, then we want to strengthen those muscles also. And so doing some work in the clinic with strengthening, a lot of times using Pilates reformer and things like that, and then also giving you stuff to work on at home to get the strength going as well.
And so a lot of women ask about the internal exam being part of all of this work. Can you explain a little bit what that entails, what they'd be looking at that way?
Sure. So with 95% of our pelvic floor patients, we're going to do an internal exam. Sometimes I don't feel like I need to because I feel like most of the stuff is external that we need to address. But yes, so with an internal exam, you're using one finger vaginally. So we're trying to palpate and touch and feel those muscles to see if they're tight, to see, and when they're tight, we can do some trigger point release to help release that tone. We also want to see what the pelvic floor contraction is like. So I can test the muscle strength of external muscles more easily, but we want to test the strength of those internal muscles too. Can you contract them? Can you relax them? Can you hold them for a good amount of time? And so then we know how to address what's going on in the pelvic floor as well. I don't usually do that the first day. Sometimes I don't even do it in the first couple of visits. There's so much that we need to work on externally that we can wait for a while to see what's going on in the pelvic floor, but most of the time we do an internal pelvic floor exam.
And is that painful?
Yeah.
Or, is it different than a pelvic exam that you're going to go in and have with your OB, or
right.
The speculum? What's the difference?
Yeah, so usually a lot more comfortable than your OB exam because we're not using a speculum. It's just one finger, so it's compared to other things that we're experiencing in our vaginal canal, especially with an OB exam, is much more comfortable than that. And also we want the pain to stay low with it. So if you're having pelvic floor pain and we're wanting to do that internal exam, We usually want to keep the pain level like to a 2 or 3 or below that, because if we cause a lot of pain while we're doing the exam, those muscles say, oh, and they tighten up more. And so we want to keep it really comfortable. So we, gauge our exam to what your pelvic floor is doing and how comfortable or painful it is.
And that brings us into how often are you seeing patients? What does a treatment look like? Is it half an hour? Is it an hour? What are patients looking at that way?
Sure. So that's very dependent on the patient too. Sometimes postpartum, if you're just wanting to make sure everything's good and looks fine and wants to get back to exercise safely, but you're not having any symptoms, sometimes it's 1 or 2 appointments just to get you on the right track. And then sometimes patients we see a lot longer depending on how much stuff is involved and how much treatment we need to unravel everything that's going on. I usually see people 1 or 2 times a week based upon what I'm seeing, but also what you can do. A lot of times new moms, you just can't get there more than once a week, and that's fine too. We can work with that. The more frequently I see you, generally the faster things are going to go, but we can work with whatever you can do. We see people in the clinic for 30 to 60 minutes, depending on what's going on.
At which point do patients come in? Is it, 6 weeks postpartum? Is it 8 weeks postpartum? Is it 2 weeks postpartum? When are you seeing these patients typically?
Very occasionally I see people before that 6-week postpartum mark, and it's usually the people that know that pelvic floor physical therapy exists and can tell that there's something not quite right in their pelvic floor. Honestly, at that point, we don't do a ton because your muscles are still just resting. So I can guide you on okay, let's do some pelvic floor contractions. Let me teach you how to activate some muscles, but you're just letting things rest still. The soonest we can really get to work, I would say, is 6 weeks postpartum. I don't want to do an internal exam before 6 weeks, and so I'm not doing internal stuff until at least 6 to 8 weeks and beyond. So use that as your guide but of course, if you're having questions and you're feeling concerned and you just don't know what to do, you're always welcome to come in before that 6-week postpartum visit as well for some guidance.
Thank you, that is incredible information. And all of the information will be listed below, especially if you want to reach out to Dr. Elissa.
Yeah.